Hi. Hi, good afternoon. So before we bring up our next speaker, we want to just share how his company, NuEyes, is helping to people with visual impairments connect with their loved ones. So we're just going to roll a video.
I felt like I had to go blind to be able to see. Now that I'm blind, I listen to people. I was in the Army for 18 and a half years. I think it's an honor to serve this country. I started losing my vision almost 3 years ago due to the problems I suffered in the Gulf War. Right now, I have very low vision. The thing I miss most is being able to see family. I don't quit. I had to learn how to even be blind. I went to the blind rehab center and I met my wife there. She's another veteran and she's been blind for over 15 years. She teaches me something new every day.
I just love being around him. We really do enjoy our quality time.
We love to watch television together. When I first started going blind, I couldn't really make out anything on TV, and I was thinking, this is how I'm going to have to watch TV for the rest of my life.
Accessibility.
And then Claudia introduced me to Comcast. Movies with video description.
Video description on.
A massive dinosaur foot stomps down into the mud.
My name is Frank. I'm here from Comcast. Nice to meet you. We would like to bring you some new technology that will enhance your vision. Do you happen to see anything right now?
Wow.
You can see me?
Yes, I can see her face. That is unbelievable. Oh, you're beautiful.
And it's also going to enhance your video experience.
What do you see?
Well, he's facing off with the raptor. It's my granddaughter. I never thought I'd see her face again. But just being able to see her, that means a lot. Technology really plays a big part in all of our lives. It's amazing. And it helps us to be a whole lot more independent. Oh my God, I don't even know if I can put it into words. That is one of the best gifts I've ever received.
So please welcome to the stage Mark Greget, who's the CEO and founder of NuEyes Technology. Welcome.
Thank you, Jane.
Well, that was beautiful.
Thank you.
Yeah. You know, I was reading about this new Ernst & Young report, how they're anticipating $300 billion worth of deals in 2020 in the healthcare, health tech space. And I wonder how many of those dollars are going to go to really impact patient lives.
Absolutely. Hopefully all of them. No, I'm just kidding.
Right. Yeah, well, hopefully all of them.
Yeah, unfortunately with the eye disease that James has and many people called macular degeneration, glaucoma, diabetic retinopathy, there's no really glasses that help them. There's no surgery that helps them. So using electronic magnification specific to augmented reality, virtual reality, and taking our patented software and our technology really helps them see again. So what they don't mention in the video with James is he's 21,000. So perfect vision for you guys was 20/20, correctable. So 21,000.
Not 2,100, but 21,000.
21,000. So
how high does it go? I mean, can you measure?
That's pretty much it. Yeah,
Yeah.
So it's seeing shadows, it's light sensitivities. He can barely see somebody walk by, it's just a shadow. And for him, again, he's from Texas, a good old boy. He couldn't really put it into words to see Claudia's face again, to see the grandkids, to watch TV again on the Xfinity Stream app. I mean, it was incredible.
Well, that's what struck me about the video. Can you imagine marrying someone and then a certain number of years later going, oh, so that's what you look like?
Yeah. Yeah.
Right.
Yeah, I mean, it's the simple things that we take granted for brushing your teeth, walking down the street, seeing a loved one's face again. The most simple tasks, it's in some cases, unfortunately, almost impossible without wearing our glasses.
So the dining in the dark dinners, have you ever been to those?
Oh, of course.
Yeah,
Absolutely.
I don't know, has anybody here ever done dining in the dark? 1, 2, yeah. It's an amazing experience where it's literally pitch black dark, and you have to figure out what's on your plate and how to get it into your mouth. And, it has a huge impact on your experience and what you taste and how much you eat and all the rest.
All your other senses kick in. Your hearing,
Yeah.
your tactile, things like that. It really puts into perspective what we really just take for granted for every single day.
So what's your vision?
So without my contact lens, you go away. So I'm 24.
that bad?
Yeah, I'm 2400. With my contact lenses, I'm back to 20/30, 20/40-ish. So I understand that. And from a young age, even from kindergarten, I didn't see very well and said, "Mom, I need glasses, please, please."
So is this what led you into?
It did. So
What
I
you're
was,
doing
I was always, obviously as we had talked about, I'm really into tech and always playing around and taking my parents' computer apart and getting grounded for it. But I was originally a medical device distributor back in 2010, working kind of on these antiquated devices. We're almost kind of the old school microfiche machines, if you will. So a screen in front of you, a little tray table, and you're working with it. And my business case or use model was a little bit different. So I'd actually go out to the patient's house. So most of these people, almost all of them, can't drive. So I would go out to their house in Los Angeles and Orange County, work with them in their house and say, "What do you want? What do you like?" And they'd try it out and say, "This is great, but why can't someone come up with a pair of glasses that does the same thing? I'd love that." And with permission from my wife, spending our life savings, we were one of the really kind of the first use cases in healthcare utilizing augmented reality smart glasses to really change somebody's life in a very, very impactful way, and that was back in 2016.
Wow, using your life savings, but of course you're in the best position to develop the product because you know exactly what a large number of people we're going to need.
Well, it really wasn't about, I think this is a good idea. This was 5,000 patients later, sitting in their house saying, "Please do this." Right. So for me, working really in augmented reality smart glasses, we're really kind of the beginning stages in 2014, 2013 when I started playing around with this. So taking these kind of crude algorithms, if you will, taking duct tape on 8-megapixel cameras on these glasses and going back out to the patient saying, "What do you think? What do you like?" Saying, "Okay, try this, do this. This is what we can do."
Iterative.
And then finally really figuring out that use case to really launch the company and be successful in 2016.
So that's still a big thing that James put on his head. So what does it do? What are all the different, it's not just magnification. So break it down for us.
Yeah, so we have 2 different products. One is for walking around, mobility. It looks like a pair of kind of oversized Oakley smart glasses.
Oakley's?
So yeah, kind of. So it's a smaller field of view though. So a smaller product, smaller compact, smaller field of view. So
how broad is the field of view?
So it's about 30-degree field of view on the smaller product.
Okay, that's quite narrow.
Yeah, oh yeah, absolutely. But for retinitis pigmentosa, if you will, it's like looking through straws. Really a phenomenal.
So it's just getting that hole in the center.
You're just getting that hole of vision, which is great. So diabetic retinopathy, kind of a dirty windshield, that it really worked out. Older stage macular degeneration, wet macular degeneration, where like James, for instance, you need that wider field of view. So when we were coming out with the E2 that you saw on the video, that came out late last year, and we were looking at it saying, okay, well, how do we develop something for the new generation? So unfortunately, the World War I, World War II guys are dying off. It's less about, just looking at a book or reading 300 pages. It's about digital content, telepresence, streaming content, seeing grandkids' faces on Facebook. So with that's the first ever VR, AR pass-through system. So you have that forward-facing camera where you can look at a loved one's face, magnify, things like that. And then with a push of a button, as you saw in the video, it's this complete immersive experience in VR where you can watch. It's almost an IMAX experience where you can watch TV again, as James had said. You can go and look on Facebook. You can do all these different things that really has never been done before.
That's amazing. And you have a patent now on this technology.
Yes, yep. So as anything goes, patents don't take a few minutes. So back in 2015, 2016, a smarter guy than me, Norman, is a great IP attorney, electrical engineer, Navy veteran such as myself. Gave him all my crazy ideas, came up with this, and then now we were granted late last year a utility patent in all of augmented reality smart glasses for magnification, for voice commands, for optical magnification, all centered around visual experiences with these types of glasses. So whether it's whether it's visually impaired or surgeons in OR or dentists using electronic loops, all these patents are really encompassing that, even such as recording surgery, taking pictures.
One of the things I was reading about on your website is, your eyes fatigue, of course, even if you do have this assistance. And so if you're reading a book or something, you can just switch it to audio, right? So there's a
Absolutely.
speech recognition.
Yep, so
component
just
to
with
it.
your voice, glasses will start reading. So it'll scan the image in real time, the text in real time, and it'll start reading it back to you. But most importantly is it's reading back to you, and you can also have a visual cue of seeing it, so it underlines it. You can make it bigger, so you actually read it along with it.
Could you highlight notes and?
Oh yeah, absolutely.
Cool.
Yeah. So I was a distributor. I was going out to these very affluent people in Beverly Hills and different things like that, and they're crying, saying, "Mark, I'm so stupid. I can't read. I don't understand." And it's really about neural adaptivity. It's really just about training your brain again because you haven't read in so long. So having that optical character recognition really built into it, not only is it giving them that visual experience, but it's helping them really retrain their brain to read again.
So the key word you just used there that got my attention was affluent. So was this a product just for rich people, and how much did it cost?
Of course
and
not.
Where
So-
are you with that process?
Yeah, absolutely. So my business model when I first started, my father's a 30-year ear, nose, and throat doctor, and he said to me, if you're going to go get into this business, there's two things to remember: customer service and patient care.
Oh, God bless your father.
Don't follow the money. He
Yeah.
said, if you worry about those two things, the most important thing is the money will follow. So for me, my business model when I was a distributor to now owning NuEyes Technologies, whether you have $1 or $1 million to your name, you're all treated the same. So for ourselves, obviously when the first product came out, it was pretty expensive, $6,000, coming down in price to about $3,000 with better and newer technology. But for us, really partnering with healthcare providers, partnering with the Veterans Administration. So if you're a veteran and you're legally blind, you can get the product free of charge. Low-cost financing programs. We just announced last week, United Healthcare and AT&T added us to the Care Plus package. So why is that different than Blue Cross Blue Shield and everybody else? Is now they're doing 100% reimbursement. And instead of, obviously, as we all know, health insurance and reimbursement takes more than a day or two. Mm-hmm. In some cases, it takes 3, 4, 5, 6 months. Now with that, it takes, if you're really, really good at it and you follow through, a couple days actually.
Wow, that's remarkable.
It's huge.
I mean, getting a diagnosis of macular degeneration is just, being condemned to blindness, as you age. And I bet, how many people here have macular degeneration in their family? Yeah, I mean, I think we're all looking at that, and this is like the first solution, right?
Yep, whether you can afford it or not, we're going to find a solution for you. For us, it's really about the assisted sales. So instead of putting it up on Amazon.com, instead of putting it up and saying, okay, let me know what you think. Well, they can't see the website. So for distribution, we actually have people go out to their house free of charge, distributors all across the US,
Wow.
in all the world, coming out to your parents' house and letting them try it on and get that experience and say, you've really changed my life. And it's really this no pressure situation.
So you're building out that distribution network yourself?
We are. And now
Wow.
currently after 4 years, we're looking at bigger partners to build that out for us to where we have 50 distributors. Now we have some kind of major players saying, okay, well, we have 1,000 people that it can go out. So we're looking at different distribution partners to take that on and really scale it as it should be.
So how long have you, so a couple of questions here. So how long is somebody normally sightless before they get your glasses?
Yeah, so the average study, which I looked at probably 2 or 3 years ago, probably needs to be updated. Usually there's a year or two of depression saying, Jane, I don't want anything. This is not for me. I'm going to go crawl in a hole. So for us, it's really about reaching out to the family members and saying, there is something. And usually once they say, okay, I want an assistive technology device, then it's easy. Say, okay, my sight is going back.
Well, and depression impacts your eyesight.
Oh, absolutely. Well,
Let's talk about that.
Well, the biggest thing is especially with age-related macular degeneration, for instance, one of the most prevalent eye diseases here, unfortunately, in the U.S. and in the world. So, if you're sitting there and you're depressed, you're tired, hungry, stressed, all these things affect your vision. So you can go from sad and it's 2,400 to 2,300 to 2,200, just depending on how upset you are. If you slept a good night's sleep, I mean, all these things that we don't think about affects your vision on a daily basis. That's why for us, really with our technology, it's variable magnification. So we want to be as neutral as possible. Variable magnification, whether it's a surgeon in the OR or for the visually impaired, making it bigger and smaller so you can adjust it on your own. So it's really, in most cases, a one-size-fits-all. So once you get it, you don't have to call us back in a year or two, which they usually do, saying, what do you have, but you really can, spend the rest of your life with it.
And then as their vision deteriorates, how hard is it for them to get the adjustments they need to keep seeing well?
One button. Yeah, so for us, we again, knowing this use case, spending all the time, doing the research and development for years and thousands of patients, we became experts in UI and UX. So it has to be as simple as possible. If you're pushing 22 different buttons, it's not going to work. So literally 1 or 2 buttons, turn it on, make it bigger, make it smaller, change color, and that's really it. So we really want to be an additive to their life.
Right. And so how many people have you gifted vision back to?
Sure. Yeah, we're surpassing 2,000 people with the new United Healthcare, AT&T. That has jumped off very quickly. One thing that I always saw when I was a distributor was low cost financing. Mm-hmm. If you can afford, a lot of people are obviously holed up, they don't have jobs. So if you can afford $50 a month, $90 a month, you can get the product. In most cases, obviously with the VA, it's free of charge.
Right. So what are your goals for number of people?
For us, we are looking to at least quadruple what we did in the past few years, and it looks to be, going that direction. Of course, with the help of way smarter people than me. So Regina is our head of sales and marketing, and has some great distributors, people that really care. So a lot of our distributors are patient advocates. So they have family members that have macular degeneration. So just the hands in the room, for instance, how many people it affects. People are reaching out saying, "This affects me. I want to make a difference in the world." And it's an amazing ride.
Oh, that's a beautiful thing, Mark. Thank you so much.
Absolutely. Thank you.